Then I'll call this meeting to order. I'm trying to, Amy, do we have a quorum? Oh, let's do roll call and then we'll find out if we have a quorum. You have to unmute Amy.
Okay, Alan Pittsburgh,
Here.
Carla Pohl,
Here.
Corey Tello,
Here.
Hannah Eisner, Judy Buchanan,
Here.
Richard Janetti, Robert Kohlhaas,
Here.
Scott Hume, Sonia Reese,
Here.
Susan Schaefer.
Here.
We have 7 present.
I think that's Scott in the corner.
Oh, Scott Hume.
Yeah.
Got it. 8 present.
So before we get going, just a couple of housekeeping things. If you're joining by, it looks like everybody's joining except for Judy. Be sure that your notifications are turned off if you're joining by phone, because any notification will cause an interruption in sound. There's a little bit of a delay, that as you can tell when you're talking, between when you unmute yourself and start talking. So when we get into discussion, if you could, this sounds, if you could just kind of wave your hand so that I know that you're wanting to speak, and then we can kind of have a more orderly discussion. I'm not trying to stifle it. I do Zoom and it's easy to talk over each other because of that delay. And then when we get to voting, you need to, sorry, I got to use my left hand. You need to wave your hand so that instead of saying aye, so that I know that you're voting yes or no or abstaining. Okay. All right. Is there any public participation?
We had an email from a gentleman that I'm going to read, if that's okay. The Board of Health should take the lead in encouraging people to A, shelter in place as per the governor's order, and B, wear face masks in public as per the recent recommendation by the CDC. I do not find either of these matters stated on the health department's website. Harry, that's DEUTSCH.
Thank you, Amy. I was under the impression that both of those items were on the website, but we can look into that. Is there a motion to approve the minutes from March 11th?
So move, Buchanan.
Second.
Second. All those in favor say aye. All opposed, same sign. Abstentions, motion carries. Did we have amounts for the consent agenda in terms of the bill? Are these the standard bills that we usually pay? Okay. Is there a motion to approve the consent agenda for the bills for the dental sealant, WIC, preventative health program, family case management, AIDS, communicable disease control, and health department? Susan, second. Sonia, sorry. Sonia seconds. All in favor? It's unanimous. Motion carries. We'll move now to the committee reports. Behavioral Health Coordinating Council.
That's me. And we
That's
did
you.
meet. Yeah. That's me, and it's also Susan on it too. So we can tag team on this. We did meet on March 13th, and part of our presentation that day was an update on where we stand with our grant programs and the initiatives, especially talked about the triage center coming online, and then talked about the Fuse program. Just a reminder to everybody that Fuse is frequent users, and this is a process whereby we identify people that are that are looking for shelters, housing, that sort of thing, that are also involved in the criminal justice world. And when we identify some overlaps there and work that up, then approach the hospitals to find out, are they also people that are seen in the emergency department? And that creates the list of 25 frequent users. And so we're still in the process of understanding and making that work well. We need to track those, work with those people. I know that 25 doesn't sound like many. We've got so many in the community, but we want to start with that group and learn how we can make that work. How we can help them better, because we know they're the major ones. We also took a look at the intergovernmental agreements that we had for funding for mental health. We have about, from 2016 to 19, we have had about $3.5 million come into this fund. And obviously part of it is going for the upgrade to the jail and for the staffing for the jail. And then the rest of it is for some case management and community behavioral health programs. So those are major things. Susan, anything you want to add?
No, it was pretty just much of an informative meeting that with what we're doing. The Fuse project right now, they're not doing any outreach on because of COVID, but they are servicing the people that are already in the program. So that's just kind of like a little update between since when we met and today. So
Good. There you go.
Have you had any feedback on how that's working in terms of folks finding the place and being served?
Go ahead.
Go ahead, Sonia.
On your mic, you started talking. Okay. Yeah. Yeah. We didn't get any direct feedback about, or that I remember, about individuals and how they're taking this at this point. It's identifying them, starting to work with them, kind of see what progress we can make. Okay.
That's perfect. Thank you very much.
You're welcome.
Mental Health Advisory Board.
Hi, this is Corey Tello. We have a meeting coming up on April 24th, and we are going to do it online like this one. And that will be the beginning of I'm sure, a very robust discussion about trying to make sure that we are identifying all the needs in the community, the gaps in service that I think is interesting, because I think through this whole pandemic, it's probably highlighting some of those needs even more. And so some things may, come to the forefront that will be good for us to address. And Amy Hancock has already put some things together to kind of help us really look at what programs have been added recently, kind of what other funders are emphasizing and prioritizing. So we'll be able to bring that into the discussion when we meet. I'm very excited about that. And another big plus is there is through the CHIP plan, the Behavioral Health Priority Action Team, they meet on April 21st, which will also be an online meeting. And I think it's going to be really good that before we have the Mental Health Advisory Board meeting, that group of people that represents so many of the agencies and entities that serve people across the behavioral health and health spectrum. We'll get their input on the 21st, and then that'll be able to be shared on the 24th with the Mental Health Advisory Board. So then, of course, all that'll be brought back to all of you. So I think that will be a good sequence. Any questions
Perfect.
on any of that?
Yeah. Thank you so much, Corey. I appreciate it. County Board, Susan?
Hi, the Health Committee met on Monday, and I just want to give a big shout out to Jessica McKnight. She did a wonderful job of explaining a lot of things to the Health Committee and answered a lot of questions that the Health Committee had. They had a lot of good questions. And if you didn't watch it, you can go back and watch it on YouTube, just like you can do this with this one after we're done. And so obviously the county has the Emergency Operations Center operating and working with EMA and IEMA and that whole process. And Jessica could probably give you a whole lot more detail about it than I can on that. We're just kind of moving along.
Great. Thank you so much, Susan. And you're up for the Behavioral Health Policy and Funding Committee.
Thank you. The meeting was canceled. We had a meeting scheduled and it was canceled because of COVID. But we have, Amy Hancock had sent out the guidelines and we've reviewed them and gave her feedback. So she has consolidated that. And I think that that's in our packet for later. Next month, we are going to probably meet and we're going to review the funding priorities and for next year. And so they may change kind of a little bit. I'm thinking because of this, we might see some different priorities come up because there may be some impact. Obviously, we know there's probably going to be impact on mental health for a lot of different people, not just what we've always focused on. So I think we're going to probably look at that pretty carefully. We've had 2 responses to the NOFO for the embedded schools, so we're going to be reviewing those when we get them. And I think that's all Hannah said for me to say.
Perfect. Any questions for Susan? Okay, thank you so much, Susan. I appreciate you giving us that report. Health Department Administrators Report, Jessica.
Right, so you all got my report, and I just wanted to add a couple things, just some updates before we open it up for questions. Just some updates in terms of operations and departments and programs. So in the MCH division, our family case management caseload has actually slightly increased during this COVID time where we have changed our services. The case managers are doing a lot of contacts. They're actually doing more contacts now, and they're doing them over the phone. So we're actually seeing also our WIC caseload has increased since they've started the curbside and the nutrition education that is done over the phone. So some of those things, we thought were changes maybe for the negative, or actually we're seeing, positive things come out of this. Increases people that they're at home, so we're reaching them with those phone calls. In other news for departments and programs, environmental health, it is our plan to stop doing field inspections. So for the food establishments going forward for at least the next 2 weeks, that is the plan that we would like to proceed with for the safety of our staff members. Again, still responding to complaints and things, but just limiting that interaction with the public for now. But that's the updates I had. Do you guys have any questions about other packet information?
I just have a question, and that is, how are y'all holding up? How's you and your leadership team, essentially, how are you all handling all the just quickly having to rethink how you do business and making sure that you're meeting all your mandates and just taking care of each other and your families, and how's all that going?
Well, I don't want to speak for everybody, but I can speak on what I know is that the team is amazing. And so I think we're kind of helping to carry each other and holding in there. The best I think I can describe it as, it's been a tough couple of weeks and really a month now, but I mean, we have great support internally is what I'm finding.
Are you feeling like you're getting good feedback from your media, the Facebook Live and the media things that you're doing? Are you feeling like those are meeting the needs of the community for getting the information they are really seeking?
Yeah, we definitely got off to a little bit of a rocky start with public information, with this being a new situation, a pandemic that, a virus that no one had ever seen before. But I think that we've got a good system in place right now with how we're presenting public information. I think that the response that we've gotten recently has been very positive. And so, we may change it and scale back a little bit as the communicable disease response amps up, but still being accessible. That was our priority, is be accessible and answer as much as we can. Because obviously, also with physical distancing, that definitely limits us and maybe not being able to do everything that is desired from the public, but giving them as much as we can.
Yeah. I appreciate those efforts. I think it's really good to know that people can get that information daily. I think that's been critical for everybody's peace of mind.
Bob, did you want to talk? Okay, go ahead.
Two items. One is at our last meeting, we asked that the staff, take leadership on being a clearinghouse and communicating. And I am very, very impressed with all the staff of being timely and very authoritative as a source of information. So thank you. Secondly, on your personnel, this is an example of how the health department has done an excellent job of being creative on positions, and the opportunity to go after a behavioral health specialist is great. My only logistic question is with going to two senior accounting specialists to take over that one position to take on more. Can you just generally describe, Jessica, how the management of two is going to occur? I mean, just in a high level, where you used to have the director, now you're going to go to two. So how does that communication and decisions, how are those going to be made?
So those two staff are currently working. One of them works mainly with more payroll things, and the other works more with the contract billing. And so that's really how it is still going to break up, where those things that the former financial division director was doing, things that are related to contract invoicing, contract billing, will go to that staff member that was already doing those things on a smaller level. So I've got a breakdown that Ms. Dreyer helped with before she left of exactly how those positions will break down. So I can bring that to you next month, because I don't have it just right off the top of my head, other than to say that keeping those things where they were, but then a cooperation. So both of those individuals work very closely together, with the bills and everything, and being under my supervision directly.
Okay, so they will report to you.
Yes.
Okay, thank you.
Sonia, go ahead. You have to unmute. Sonia, you have to unmute.
I see Judy Buchanan's microphone is on, suggests to me that she wants to talk. Sorry.
Judy, did
Carla,
you have a comment?
I did, and I think actually it's along the very same lines as Corey and Bob. and that is how impressive our response, your response has been to the current situation. As Bob used the word authoritarian, the leadership has just been so obvious and much appreciated. And secondly, I too am really excited about the personnel inclusion here and our opportunity to continue really good work on our budgeting, as well as bring into the system a very much needed additional behavioral health person. So well done on both of those. Thank you.
Susan, go ahead. Oops.
Excuse me. Can you explain to me what you mean by the behavioral health specialist and what that is different than Amy, and what that all is going to entail? Because I don't remember what that was about.
Yeah, this actually will be a new position. And, oh, Amy, did you want to expound on it a little bit? We've had some conversations about it.
Yeah, I'm sorry, and I can't like see everyone on my computer. But if you want me to explain, Jessica, I would be happy to, or you can definitely take the lead.
You go ahead and talk, and then if anything else is needed, I can jump in.
Okay, great. So the behavioral health specialist is going to help support the behavioral health program, mainly as far as like collaboration with the different behavioral health community partners, and also the developmental disability partners that I work with as far as on the 377 board. And then they're also going to, some of the roles I've taken on as far as within the health department and trying to incorporate behavioral health initiatives and the trauma-informed care initiatives. The trauma-informed care initiatives. So that person will assist in doing that, and especially with the trauma-informed care, moving that forward. And then just helping just like an overall, so like I have a lot of like visions for the behavioral health program, and as far as like just trying to move it forward and really kind of like step it up as far as like how we can really help promote and protect health as far as like in the behavioral health world, and especially for individuals that have developmental disabilities. So I'm kind of looking for that person to just really take on that under my leadership, just take on that role and just have an opportunity to like really expand in that area. But as far as like monitoring the contracts for the Board of Health and the 377 board, that's kind of more of an administrative task. And so I would keep most of that myself and then have them take on some of the other kind of outreach opportunities.
Thank you, Amy. Any other questions? I just wanted to say that we have been at ISU have been doing a lot of obviously all online teaching in our clinicals, and I've heard from more than one faculty member and several students about how much they like the website, how easy it is to operate through the website and to get information. So kudos to everyone for working on the website and making it, easy to, and when I was looking up, when I went through different counties and looked up the information, Cook and I didn't go through all the counties. I just went to the counties where I know we have students at. Cook and ours were the easiest ones to find information. It was on the front page. So I just wanted to say thank you. Question, do you want to talk? Are you saying thumbs up? Sonia? Okay. All right. Now we're going to move to a discussion of the protected health information. We've had, I just want to start this off and then turn it over to Jessica. We've had some requests, we meaning the health department, have had some requests from first responders for a disclosure of personal health information, mostly name and addresses of folks who have tested positive for COVID-19 because they're concerned about protecting themselves and protecting from transmission. We've had the Governor Pritzker's weighed in. The IDPH has also given us some guidance, as well as the state's attorney. So I'll turn this over to Jessica, and then if you guys have questions and we want to discuss it, we can do.
So, we've shared in the packet information from HHS and from IDPH. And so so HIPAA allows us, it permits us to disclose personal health, protected health information, but it does not require us to. And so in this instance, there's obviously, things to weigh, because there's a benefit on both sides. There's a benefit to providing the information, but then there's also the risk of protected health information going out there and potentially being at risk. So just wanting to, I'm obviously new in this community. I'm new to you as a board, and wanting to hear from you on your feelings on this situation.
Go ahead, Susan.
I guess nobody either wants to talk or doesn't want to go first on this one. Um, my personal opinion is that we should allow this to be given to 911, to Metcom. They have a lot of other very sensitive information that they have in their files, or in Aegis, or wherever it's at. And so law enforcement they have a lot of things. They know when someone has repeated domestic abuse issues, so they send more squad cars. If someone is autistic, they some of them that can have a flag in there. If they have a mental health indicator, there's a flag in there. That's also protected information. If they're diabetic, that information is in there, so that they know how to respond in those situations. And when that happens, they happen to know, and they don't necessarily want the names. They just want an address. They just want to know if at 123 Main Street has a case of COVID or has been positive, that they can make sure that they put on more protective equipment, personal protective equipment. And there are other counties that have already given that information from the health departments to their dispatch centers. And I can list a bunch of them if you'd want. I know Decatur just gave theirs, or Macon County just gave theirs to Decatur because the Decatur police chief was going to sue them. But hopefully that doesn't come to that, and we can come up with that. But they do have a lot of sensitive information in those files, the social security numbers and things like that. So I think that in order to protect our first responders, that this is information that they should be able to have, because if you look at some of the places like New York City and Chicago as to how many of those first responders are now coming down with COVID, and then we're impacting public safety in the long run. And so that's just my opinion. And I strongly suggest we let Metcom have that information, at least addresses.
Just as a point of information, addresses are protected health information. And the second thing, I'll be quiet here in a minute. COVID is so widespread in our community that I'm not sure that them having the information of folks who are positive is going to protect them. I think. All right, Judy, go ahead.
Yes, thank you. I was going to mention that they have requested the names and addresses. And are you saying, Carla, that the address could not be given to them?
No, I'm saying that addresses are considered protected health
Yes,
information.
Right. So
Under
because
HIPAA.
I think.
And you just scare the heck out of me, Susan, if they have our social security numbers.
No, in terms of.
Better not have my social security number. We're going to.
I'm in support of giving the addresses, but I think I would strongly urge that it be with a very strong caveat that, as the documents we received indicated, we don't want any first responder to have a false sense of security, because that person that at that address may have had a positive reaction and may be just fine now, and there may be someone else, next door that now has it. So I think we need to remind them how strongly that they should be prepared when they go to any of these places. But I too, like Susan, am aware of very sensitive information. In fact, had given the address of a family member in the event there was an incident relative to behavioral health. So I do know that they have that, and I have had no reason to think there's been any abuse. But I think we should very much remind them that this does not mean that they can let down on their precautions in all situations.
Thank you, Judy. Sonia, did you want to say something? Go ahead.
Well, I'm just reminded that we should assume everybody has it and treat them all very, very carefully. If I don't have it today, that's only because it hasn't shown up on me, and it might tomorrow. So that's kind of my feel. I'm okay sharing it, but I don't want to lull people into the feeling that, oh, if I didn't get Sonia's name, then she must be okay, because I don't know that I'm okay. What about the rest of you?
Alan, go ahead. Unmute.
Yeah, I got it. Well, first of all, I agree with pretty much everything that's been said, and we are now at the point where it is being recommended, even in public, for everybody to be wearing masks. So I think that the level of, and I don't know what the EMS protocols are, but I think that the level of protection that they wear in general to just about everything now is higher than it used to be. That all being said, I think that if they know that they are responding to a COVID case or a COVID house or whatever, they can amp up that PPE, N95 masks or PAPRs or whatever, and face shields and all of that stuff. And the thing is that right now, that equipment, right now we have enough of that equipment, but if they have to use that on every call, then we are going to run out of that level of PPE, which is so cherished at the moment. And so for that reason, I would say that I do agree with giving out that information to just very limited people, but Metcom would be one of them, so that they can identify potential patients where they would have to go in with a higher level of PPE.
Wait a second. Bob, did you want to say something?
Yeah, I was interested in what Dr. Ginsburg had to say about this. I think that overall I would support supplying the information, but I think it's important, how does that information get into Metcom to have it very guarded, as Susan was talking about. But the other observations are, the Illinois Department of Health is recommending against it, and so how is our recommendation, the basis of our recommendation as compared to theirs, and Dr. Ginsburg did answer a question. It seems like every call they would have a certain level of care, so therefore you would not need to know this information just from an analytical standpoint, but that was a good example that they would amp up the level of protection, and then that could be a drain on the supplies. So overall, I think it would be a responsible thing to have information provided. But I would want to understand, like one of the examples on page 10 of our packet, the first example is talking about giving a list to EMS. And so if that's a flag that they have, Susan, that you talk about of certain information, so it'd only be known to someone if they were going to a home that had COVID. Otherwise, no one would know about that information. Is that true?
Jessica?
So that is my understanding. And so in talking with state's attorney's office, my concern has been about the information, if it was shared, the protection of it and the security of it once it would leave us. And so, that maybe not answer the question, because we looked into the potential of, if we did that, signing a business agreement with MetCom. And so then, having them signing something that this is how we are going to secure the information, or that we're going to protect it in that way.
Go ahead, Susan.
I think that is where, and I don't have the depth of knowledge on this, but that is where, like I had mentioned before, that MetCom, there's a lot of sensitive information that's out there, and that the law enforcement and EMS know how sensitive this information is, whether it's, PHI or your social security number or whatever. So it is secure with MetCom, and it's on a per call basis. If someone calls in to 911 for dispatch, and they have a little flag that says COVID at this address or whatever, that's all it is. It's not, and it's not making lists of people and lists of addresses to be sent out to whomever. That they deal with sensitive information constantly, and so I think that if you talk with MetCom, you talked with Tony Cannon about how they deal with that kind of information, and when they get a call in, I think that might ease some of your concerns or as to how secure that information is. But if you look at criminal justice records, they're very secure. I mean, nobody can see those other than what's on the public part where you can go query somebody. But a lot of the detailed information about it isn't available to the public. So I think that there's concerns, and I understand that, and I see both sides of it too. And but I really do think that that we can make sure that this information is secure and makes people feel better about releasing that information to that. And it's on a per call basis, just like it was on what it says on page 10, on a per call basis. So
Corey, go ahead. And then Jessica, go ahead.
So would it be of any value if we had in writing the security and privacy policy of MetCom, so that we could kind of see that as a show that we as a board or whatever had maybe become very familiar with that as part of our decision? Because I certainly think the risk issue here for first responders is a paramount issue. So, but I just wonder, would we be doing our due diligence if we ask that we have that MetCom policy in our hands, so that we can say that we see it in writing, not just that we kind of know how that we've actually seen policy? Would that be beneficial?
Jessica, go ahead.
So I think it might be beneficial, and really I think what it sounds like is we need a conversation with MetCom to just delve a little deeper into this. I also think, I'm doing a disservice to public health if I don't bring up the trust that we have developed with the public over the years. We deal with a lot of very sensitive information, and it has taken a long time for public health to build some of that trust and rebuild it after it has been broken in the past. And so, there is always the chance that less people will get tested for COVID because they are afraid now that their information is being shared. And then that trickles down into even STD testing, all of that testing and those services that we provide, there's always that potential. So, there's risks on both sides. There's the risks, obviously, of the protection of our first responders, but then also the risk of, to the public if we are losing that trust that they have in us.
Go ahead, Alan.
Has the state's attorney's office weighed in at all?
Yes, and so they're weighing in. I talked with them earlier, even today. Jessica, did you?
Hi,
Go ahead,
everyone.
Jess.
Yeah, Jessica and I had a conversation earlier today, and basically from my analysis of it, and I'm no HIPAA expert, is that it's totally up to you. You can release it and be fine legally. There's no violation of HIPAA to release to law enforcement professionals, and that would extend to firemen and EMS. And the Attorney General even came out with an opinion recently that said that same thing, that you would not be in violation of HIPAA for releasing this information. There's also the public health side of it that says you can, but it doesn't say you shall. So if you decide not to release the information, you're also not breaking the law. So you're not breaking the law either way. That's not very helpful to you, I know. But it at least removes that legal aspect from it, that you can decide to release it or you can decide not to release it. And it becomes more of a policy issue at this point and not a legal issue.
Hang on, Susan. I've got something I want to say before I call on you. Having survived or been through the issues that we went through with HIV in the 80s, well, for me, it was in the 80s and the 90s. I'm really concerned about releasing information and the breach of trust that that's going to present to the community. And I understand that we're trying to protect our first responders. I want to say something, and this is not a comment about testing, but we just started doing testing to people that have symptoms. Before this, our testing was limited to first responders and healthcare workers. So we have absolutely no idea how widespread COVID is in this community. So I'm hard pressed to understand why releasing if it was me, I'm not positive. If it was me releasing my information to EMS, knowing how we all talk, would, in a community as small as ours, is going to help protect anybody's health or security, because you could shed the virus when you're asymptomatic. So no one knows when they respond to anybody, whether they're going to get the COVID virus from them or not. And I would imagine if you go back and look at New York City, for example, where the virus is really widespread and is where they have so many problems, where they've had so many deaths of their first responders, that it probably came from normal community contact, more so than responding to. Sorry, go ahead.
I just want to point out that Metcom is a county department, so it's still within the county, so we don't really need an agreement with them. They are a county department.
They don't have the same HIPAA standards that health professionals do. Go ahead.
All right. I understand. I mean, I lived through the HIV era too, and yeah, I was a resident during that time and was starting IVs on HIV patients, not knowing even what HIV was at the time. this is different. I don't think that this disease has the stigma that HIV has. And it is much more contagious than HIV ever was. And the other thing that you have to consider is that the most high-risk procedures that are done to patients with this disease are procedures that are done by EMS. Intubation, bagging patients, those are absolutely the highest risk procedures for spreading the virus. And so I feel that either you have to tell EMS to wear maximum PPE for every patient they see, just on the possibility that they may have to do one of these procedures to them, or you can tell them, well, you know, we don't think that this is a patient, and you wear your regular stuff, but you may have to. I mean, if they're intubating somebody in the field, they're probably going to, no matter what, have to put on the maximum PPE anyway, because that's kind of what we're doing now in the hospital. Luckily, right now, the hospital's been very quiet. I said the bad word. I'm never supposed to say.
Shame on you.
Yes, never supposed to say the Q word. But at the same time, what we are, I mean, this is what we're going through all the time now, is trying to figure out exactly how much PPE we need, and is enough, and you know, I think it is of some use to the system in general if they can conserve on PPE as a result of this.
Does anyone have anything else they want to add? Go ahead, Sonia. Sorry, you guys. Every once in a while, I get this bar that blurs your faces, and
That's
so
okay.
that's what I'm looking. That awful face that I have is because I can't. When I'm looking for hands, I can't see.
I think I'm hearing an argument from a variety of sources. It's not illegal for us to do that. Jessica, you told us that. And it might help in somewhere to preserve some very precious resources that we have in a small amount. And if this shows a support for our partners in MetCom and all the people that are out there, I'm in favor of it. So there you go.
I need some guidance. This wasn't a action item on our agenda, so I think Jessica was just looking for guidance. Jessica McKnight was just looking for guidance, correct?
Correct, yes. Again, wanting to make sure that if I'm making a decision, it is a decision that is backed by the board.
Does anyone have, oh, I'm sorry, Corey, go ahead.
I guess I'm back to what I said earlier, and that is, have we as a board done our due diligence to really get more familiar with MetCom's security and privacy policies? And what I'm hearing you say, the issues are between, on the one hand, protection of the first responders and their needed equipment. On the other hand, it's the trust and privacy of our citizens and our clients. So is there anything that would help tip the scale more one way than the other that would help with this decision? I mean, are there any factors that we have not yet brought forward that should be brought forward?
I don't believe, go ahead, Bob.
Oh, I'm going to restate, because I don't think we've really addressed it, is in bold on page 5 of the IDPH release. you know, it's clear that they talk about, you know, limited epidemiological and infection control value of releasing this. So I just want to be consistent that we have a strong basis of our decision, but really it boils down to how would this information be released? And I think that's what Ms. McKnight is looking at, is to understand how would that information be inputted and protected, because again, it seemed it would only come up if you were actually going to a COVID house and the check mark came up. So those are the two items that is what that are out there for me.
Go ahead, Susan.
I guess maybe this is a question for Jessica Woods then, maybe, because would this be an Aegis? And I don't know enough about Metcom, and it's not really like what you call released. I mean, when you use the word release, to me that means, oh, here's a list, you know, and look at all these, you know, names and addresses, but that's really not what that is. And so I don't know if Jessica can maybe address that a little bit better than I can.
Yeah, so what I've heard is that we would give a list to Metcom and also to the Bloomington Dispatch Center, because they are not part of the Metcom group. And then as they dispatch people to an address that is has a positive COVID case, they could alert the first responders to that, because all of the directions to go to different addresses come from dispatch, either Metcom or Bloomington. So as Susan stated, Metcom is part of the county, so we wouldn't need a separate BAA with them because they are us. We may need to put a business associate agreement in place with Bloomington, if anything, and I'm not even positive we would need that. But out of an abundance of caution, if we did that, which basically says under HIPAA, we're giving you information and you agree to be bound by the terms of HIPAA and not share this, then that's how the information would be dispersed from the health department to the first responders. And then they would have some sort of procedure for if they were, you know, called to a house, that the first responders would be alerted to the fact of a positive COVID case there by some 10 code, like, you know, 10-4 or 1080 or something like that, that would not tell the general public what that means, but it would tell the first responders would understand what that is. Another option would be just to call the first responders or the sergeant on duty and to let them know via secure connection on cell phone or landline that they're going to a COVID positive residence or address. So those could be worked out to ensure that the information isn't floating over the airwaves. But that's kind of what I've heard floated at this point. Does that answer your question?
Bob, did that get to Corey? Go ahead. Go ahead, Corey.
We're put in the wrong place. Are there any, like in this business, I like the idea of this business, what is it, business associate agreement, because it makes it maybe real clear in what is being exchanged. And are there any, is there anything that can be put in that kind of sends a message about our desire to be sensitive to the privacy needs of the citizens? That kind of lets us meet needs of first responders, but also tells citizens and our clients that we very much understand our role in protecting their personal information. Does that make a difference? Does that help in any way, or is that just words?
Well, from my understanding, all that law enforcement want is an address, so it wouldn't be any further private information that would be handed out other than an address. You could add a name if you wanted to, But that's the maximum extent of the information that would be released. If, for instance, a first responder decided to release that information beyond the scope of their duties, that would be on them. It wouldn't be a legal liability for us, at least because we are legally able to release that information in these circumstances.
Unfortunately, that type of inadvertent or intentional release would have significant repercussions on the health department. And I'm obviously in the minority here, but I'm still struggling to understand how this is going to protect our first responders when the virus is so widespread in the community already, and no one knows who has it, is asymptomatic, has a mild case, but it's still, I mean, that's why we're all wearing face masks, or well, some of us are wearing face masks in public, is to keep our droplets to ourselves. It's not to protect ourselves from getting the disease, it's to keep other people from getting the disease. But it sounds like everybody's comfortable with the release. I hope everyone is aware of the repercussions that will come from this. And I don't think anybody, I think oh, I'm sorry, Judy.
No, finish. Oh, I a couple of things. It's my understanding that if we take this action to release with some additional language as to our expectations, that is between us and the first responders. This is not an action that Jessica would take to the general public. That's not to be released. Am I correct?
Are you meaning the information, or?
Well, one of the comments was that we have a responsibility to the public, and I certainly would not argue with that, and I think we've exercised it well. But this is not the kind of action that would be in the form of any kind of a release to the media that we are now doing this. I wouldn't expect us to do that. It sounds like we're just doing it consistent with policy that's already and procedures that are already in place and are used by our responders.
This is a public meeting. I'm sure that since we all know that Macon County releases their information, that it won't be but 30, 45 minutes before people would know that McLean County is also releasing addresses and patient information.
But in terms of patient information, okay, well, we're talking about releasing addresses. And I've read the materials as well, and I've been listening. This will not afford the first responders, in many cases, much more protection than they should already be exercising. But to me, it seems like it is a goodwill decision with our partners. We are all in this together, and we have had a lot of cooperation, collaboration, and our partners, particularly within the county and our municipalities, are asking for our help. So I don't, and there again, I think we underscore with whatever language we put in a business associate agreement that we want to be sure that they are prepared when they go into any home, not just those homes that might have been flagged with an address on their system, so that they are not sensing false security, but that as our partners, we want to acknowledge that if they would feel more protected, falsely or not, that with this information, I continue to think we should do it.
Bob, did you want to say something? Somebody else had their microphone.
Yeah, I'm going to once again repeat. So the basis of us not following the recommendation of the State Department of Health, I want to understand why our position would deviate from that. And then two, I think it's important to respect the staff and their feelings about releasing this information. But again, we do want to protect individuals who are intentionally going to help someone who may have COVID. So this is a very intense conversation that's hard to come to a conclusion. So I think we owe Ms. McKnight some direction after we finish this discussion. I don't know if anybody can answer some of those questions.
I'm sorry, Tammy, go ahead. Tammy.
I did not get permission to speak from my administrator, so I hope I have a job tomorrow.
If you did have permission.
My communicable disease staff would be highly disappointed in me if I did not share their thoughts on this. We are very, very uncomfortable. We're just not used to sharing any information. A couple of things I was writing down as I heard people speak. One of the things is that under normal HIPAA circumstances, an address and a diagnosis is a breach. I realize that it has been loosened a little because of this evolving situation that we're dealing with. Some of the questions that we have are, so you have the addresses, but what about traffic stops? You don't have that information for a traffic stop if the person you're pulling over might be COVID positive. One of the other things is that someone in a household that is COVID positive isn't contagious forever. So how do we maintain that that list of those coming off of being contagious and those being added, which would be quite taxing for staff who are already very, very overworked. Another concern was law enforcement in particular. Now I'm sharing all of these thoughts that I've heard. This isn't all just what I'm saying. Another concern was if someone is called out to respond to a domestic battery situation, the extra time that they take to put on the extra PPE could mean someone's life. Again, I've heard people say we should just treat everyone like they have COVID. I mean, that really is the public health stance at this point. It is so widespread. We don't know who all is positive. So we certainly don't want to give any false sense of security to any responder. I also heard someone say, how do we know, I guess, I think, Carla, you were talking about the widespread in some of the larger cities. Do we know that they contracted COVID because, or in the line of duty, or was it in their private life? That was another thing that I heard. Another thing that my staff has shared is that under normal circumstances, we don't even share between departments the diagnosis of even our common clients that we see. So what happens in the CD clinic, the folks in WIC aren't privy to. We're seeing the same clients, but it's a need to know basis. We have such value in the protection of that privacy. It's a really, really hard thing for the staff in the communicable disease program to be contemplating. One of the other things that was said, one of you all said it, all the other counties are doing it. I certainly hope that we aren't operating other ways based on what everybody else is doing. But I will say, in communications with those counties, they made the decision to share before guidance came out from IDPH. And some maybe would have reconsidered if they would have had the guidance. I think that was all that was on my list, but thank you, whoever said I'm wondering what staff is feeling, because the staff that are dealing with the tracing and the tracking of COVID right now are very uncomfortable. Thank you.
This is Jessica Woods. Can I just clarify something? Nothing in HIPAA has been relaxed through this process. Law enforcement, there's always been an exception in HIPAA to allow information to be shared with law enforcement. And so this is just utilizing that exception in HIPAA. So just wanted to clarify that.
Yes, Alan.
I got a question for Tammy. Forget about COVID-19 for a second. What is the policy of the health department if you have a patient that you are following with active tuberculosis who is being non-compliant with their medications and is going out in public? What do you do?
Tammy, do you want me to talk to it, or do you?
I was going to ask either you or Kathy CA. I actually do not know the answer to that question, but I do know that when you're speaking of non-compliance, some different rules, so to speak, come into play. But let me have Jessica speak to that, please.
Yeah, so that actually is one of the things that is listed in there, where in that instance, when there's non-compliance and you do have to take legal action, then that information may be shared. That's another one of these exceptions that Ms. Woods was talking about. Is those are those cases where that information may be shared with them, but it's kind of a last case scenario where legal action, we've tried compliance and we could not get it, and that's the only thing we can do is now legal action going through the state's attorney's office, the law enforcement, and taking that next step.
So that is, that's an example of a public health threat from an infectious disease that's not nearly as contagious as COVID or coronavirus is. And so, I don't know. I just think that these are very, very extraordinary times. I mean, I don't know of anybody who knows of a time, maybe unless you were alive in 1918, where we had the entire population of the United States essentially shut in.
Go ahead, Jessica.
All right, so I guess just for us to continue considering, the minimum amount of information is what it continues to say. What is the minimum amount of information that should be shared? And so again, hearing your opinions on this, I would be open to conversations with MetCom to explore this. But again, when it says that it's not in IDPH guidance, it's not recommended, it's because it's not epidemiologically necessary at this point, with there being widespread. What is the minimum amount of information that we need to be providing in order to protect the first responders? So again, I'm open to having a discussion with MetCom and exploring this further, but there's so much for us still to consider, I think.
Jessica, I don't know so much that the discussion with MetCom really is about the security of the information. What I would really be looking at is as a discussion with the EMS coordinators. How would they use that information, and how, either, with Normal Fire or Bloomington Fire, how would they use that information? How would it change their approach? Because, I'm starting to come around and hearing all of the different arguments, and I'm thinking that unless they can give you a good reason that this would absolutely change our approach to how we approach our job, then it may not be worth the risk to to release the information. So I think it's not just because Metcom and the Bloomington Dispatch are really only the people who would have the information, but I would want to know what people would do with the information.
Yeah, that's a really good point. Yeah, how is that going to change their procedure? What will they do differently with the information and also protecting the information?
Sorry, Susan, go ahead.
When the sheriff contacted me about this, because I was asking some questions, just like we all are here, to make sure that I had a good understanding of this. And one of the things that he said when they go out on a call, and I'm sure that this applies also to fire and EMS too, is that if they can, they try not even to go into a home, you know, and that if they and they try to do the social distancing. If they have a traffic stop, they're going to try and stay as far away from them as possible. They're not going to be on top of them or anything like that. And that, but if they had that indicator of some kind that said that they, you know, there was a COVID positive here, then they would put on more PPEs. Because I asked him that question. I said, so what would you do differently if you knew that? That's the point blank question I asked him. And he said, well, we would put more on. So then that goes back to what Dr. Ginsburg said about not utilizing all those resources if you don't have to. And so I think that they have their procedures in law enforcement and fire and EMS or whatever, and how to approach different situations. None of us are any of those kind of people. And so we really don't have that kind of, you know, in-depth knowledge in order to say, well, I've done this and I know this is how we do this kind of thing. So I think we just have to trust our partners, which is Metcom and Dispatch, because they're the ones that are going to be entrusted for that information. And so, but they would do things differently if they knew, from what I was told. So.
Anyone have anything else? I'm still want to say that I'm not sure if they did something differently with someone who had COVID that it's going to make any difference in terms of them getting the disease. Jessica, does that give you the guidance that you needed?
Scott Hume, is Scott wanting to talk?
I'm sorry, Scott, go ahead. I'm sorry. We can't hear you, Scott.
Scott, you need to
Anybody-
unmute. You need to unmute,
He is
Scott.
unmuted.
Oh, he is? Okay.
I can't, do you have your sound on your computers that turned on? Can anyone else hear him? Because I can't hear him.
No, can I recommend that he call the dial-in number that's in the invite, and that way we can at least get the audio to go with?
Scott, did you hear him? He wants you to call in on the phone. Somebody else had their microphone on. Sonia, was it you?
We're just going to point out that Scott was wanting to talk.
Oh, okay.
He was lost in that. I've waffled so much, it's hard to know where I am. Tammy, I totally appreciate all the things that you've shared tonight about staff and how careful everybody is in protecting the information. I'm also aware that this is different times and different a different organism that we're dealing with. And I don't know. My first thought was be protective for everybody. And it sounds like John Sandage was saying he really needed to know that information. I would hope that in the long run, they're using the same care with every stop, assuming that that might be a patient with it and not take things easier. I realize this short supply of protected and vital PPE, but I think it's really a question of whether we're going to let that whole information go out or not.
Scott, can you just start talking? Let's see if it works. Oh. Do I need to do anything differently to get him to, if he's on the phone?
No, when he comes in on the phone, he'll be able to speak.
While we're waiting for him, I just wanted to comment. I think someone mentioned the IDPH advised against releasing the information to law enforcement. They may have at one point, but their current recommendation is that you're permitted to, but not required to. So I haven't seen anything that says that they say don't release it. They also don't say do release it. They say you're permitted but not required. I think Susan, you mentioned that Macon County might sue. They have filed a lawsuit. The sheriff has filed a lawsuit against the health department for not releasing the information. So that is a pending lawsuit currently.
Okay, Scott, go
I think I'm
ahead.
Yeah, I was saying that at this point, let me turn the mic volume down here. There doesn't seem to be a shortage of PPE equipment locally. Is that correct? And if that's the situation, I think that there's it's going to be easier to get PPE equipment in the near future. Because in fact, I got an email today that I can order N95 masks that are available now through the dental supply chains. And from what I heard on one of the dental forums was that 80% of the world's masks are made in one location, and that location is Wuhan, China. So, and they're coming back on board now with a lot more production. I don't know if that's true or not. That's just what I heard. But so I think I would be more inclined to not give out information and have, like I treat every patient I see like they have hepatitis or AIDS or and same thing with COVID. We'll do whatever we can to maximize our safety and their safety. And so if they have the PPE equipment available at this time, I would recommend that we not give out personal information. But if we do get to the point where we have to ration it, or they're wearing the same mask all day long and things like that, then I'll be more inclined to give the information to the first responder people. Thank you.
Jessica Woods, can you give me some guidance on what our next step should be? Should this be a voting situation or not?
No, it actually can't be a vote because it wasn't put on the agenda item for a vote. I believe, and Jessica McKnight can correct me if I'm wrong, she just wanted some input in this conversation to kind of direct her in her response. It's ultimately her decision what she does, but I think she values the input from the board members.
Thanks. I just was making sure. Jessica, do you have any questions of us?
I'm just trying to figure out where everybody stood at the end of all of that.
Can I say something?
Sure, go ahead.
I guess I would just say, I think there's been some this was a wonderful discussion. I deeply appreciate the seriousness with which we weighed the pros and cons of this. And I feel like obviously IDPH also came to that same place of it's hard to call this because you could easily argue each side of this decision is an okay decision. So I guess, does Jessica, do you need to just know from us that we trust? I mean, is the best thing we can do right now is say, we have put out all the important facts of how to weigh this, pros and cons. And then we do trust Jessica to make the best decision, knowing that she has staff that have to live with that decision in a different way than maybe we do. And that we, it's like we would be okay either way she goes. Is that something that we can say, or is there somebody, again, is there some reason that is so intense on someone's part that they need to state that to say why she should go in one direction? Most definitely. Does that make sense?
That's an excellent summary, Corey. Thank you.
Yeah.
Yeah, I support our directors. I support our directors' decisions based on the dialogue here and also based on the constant information that the whole health department is assessing.
Alan, go ahead.
Yeah, I also support Jessica's actions on this, whichever way. I think first of all, we can't wait till another meeting to make a decision like this. This is, this has to be made before we can meet again. And second, I think that, I wouldn't make it like right after this meeting is over. I think she needs to get some more information. And I appreciate everything that Tammy said. And because I live that life all the time also. And I can definitely understand it. So I think that you need a little more information to make a judgment. The one thing is about the security of the information, and the second thing is, what are they really going to do with the information? How is it going to adjust how they approach it? So yes, the sheriff's office and the police and fire departments, but also the EMS system. And I don't remember who the EMS director is right now, but I would find out who the EMS director is, because they are not part of the county. And they're working out of the hospital, one of the hospitals in the ER, if not both.
Anyone else? I too support Jessica. Go ahead.
Sonia and I support being there, talking with them, understanding, and I appreciate all the questions that we've suggested that you raised with them. They need to think this through as well.
Thank you, Sonia. Go ahead, Sue.
I support Jessica. I would like to ask her to get more information before she makes a decision. And if she has not yet already, I would ask her to talk with, yes, EMS that Dr. Ginsburg mentioned, but also Chief Bleichner and Chief Donath from Normal and Bloomington, because I believe that if you have not, that they could probably provide you with a lot of information and reasons why they are interested in having this information. And also continue talking with the state's attorney's office and like I said, talk with Metcom to see their security procedures and get the most information that you can on that from all of those people, because they have different viewpoints, just like we all have different viewpoints. And like I said, my viewpoint is to go ahead and let them have that information. But for you to make sure that you have all of that information to contact those kind of people. So that's my suggestion if you haven't already.
Scott, do you have any more? Do you have another comment?
No, I just not sure how to turn my microphone off. So I don't have any more comments, so no.
There's somebody with CO. Do you want to speak?
I think that's Scott.
Yes,
Oh, that's
me.
what I thought, but oh, okay. Just making sure. Jessica, do you have anything else you need?
No, I appreciate that this is good guidance and, to move forward with getting more information before I make a decision.
Okay,
Thank you guys.
thanks. Thank you. And you guys, great discussion. I really appreciate everybody being patient with the technology. So let's move on to our 2 action items, if that's all right with everyone, I hope. I'm not hearing anybody making threatening gestures. Do I have a motion to approve the Board of Health bylaws that we discussed at our last meeting? Alan so moves. Bob seconds. Hope everybody doesn't mind me using your first name. Is there any discussion? All those in favor, say aye, or wave your hand, I'm sorry. Do the hand wave. All opposed, same sign. Everybody put your abstained. Motion carries. That was unanimous, Amy. All right, and then approval of the funding process documents that Amy Hancock has circulated with us. Is there a motion to bring that on the table? Corey? So moved. Scott second, or Susan? Scott beat you to it. Any discussion or questions? Concerns? All in favor of passing the funding process document with the hand?
Aye.
Aye. Any opposed? Well, thank you, Judy. Any opposed? And abstentions? And so the motion carries unanimously. Does anyone have anything else that they would like to discuss? Bring up? Yes,
I have something really super exciting to share.
great.
We have a dentist who is interested in being our adult dentist here at the health department. I have invited Dr. Hume to be a part of that process. As you could probably all assume, I have no idea how to hire a dentist. I don't even know what questions to ask, what paperwork I need from them. So he has been providing me some assistance on that end. Dr. Hume, I had originally said that I was trying to set up the interview for tomorrow, but I think it will be next Tuesday instead. So if any of you would like to submit questions to me, or I suppose even be a part of the sort of meet and greet, virtual meet and greet with this person, that would be great. It sounds like he's very excited to be a part of our team. He's got public health in his heart. He participates in the biannual extraction clinics. He's a part of that. So he really believes in community-based care and kind of giving back and that kind of thing. So I'm excited. I think there's a lot of potential there. So
That has to be the best news ever, Tammy. Thank you so much. And the same to you, Dr. Hume, for, or all thumbs up for helping out with that process. Thank you so much. Anything else? Then do I hear a motion to adjourn? Susan, and second by Sonia. All in favor? I think everybody's in favor. Okay. Thank you again. You guys have done 2 hands up. Tammy, you don't get a vote. Everybody, thank you so much for everything that you've done. You did an excellent job. I think we did a great job with the head.
You did a great job. Thank you, Carla. You did a very nice job leading us through this. Thank you.
You're welcome. All right, so everybody, be safe. Don't forget to wear your mask, wash your hands, stay at home. We don't want to let our
Good plan.
guard down because we don't want to look like New York. Nice, Tammy. Um, Tom and Kim and Tammy and Kathy, thank you so much for what you're doing for us. And Tammy, if you could tell the folks in CD, I can't thank them enough for what they're doing. You're doing an excellent job. All right, the meeting is adjourned